Hi, it's the nursing professor. In continuation of my last video where we talked about how to determine if something was acidotic or alkalotic, then I want to talk today about ABGs and which disease. All right, because that's really the whole gist of it all. Just knowing numbers is not enough. So remember, we're talking pH, 7.35 to 7.45. If it's below that, we're talking acidosis. If it's above that, it's alkalosis. So let's take a look at respiratory acidosis. This is when your carbon dioxide is really high in comparison to your pH. And typically a person is hyperventilating. Think about they're unable to exhale the carbon dioxide. So that carbon dioxide is actually building up. So diseases you might see respiratory acidosis in include COPD, those people who have the barrel chest and they have difficulty exhaling all of the excess CO2. People with drug overdoses like opioids or sedatives, or even people that have been treated with anesthesia can get a buildup of carbon dioxide. Those with head injuries where the central nervous system may have been depressed, because we know that they have to be triggered. Those people who have those injuries are triggered in order to breathe, which means that carbon dioxide again can build up. People with severe asthma attacks, and any type of neuromuscular disorder that may impact breathing. So always remember, with respiratory acidosis, you're looking at disease processes that occur when the lungs are unable to blow off excess carbon dioxide. So think hypoventilation. Sorry about that. All right, now we're going to respiratory alkalosis. So that means that pH is above 7.45 and the carbon dioxide is lower. So remember Rome, this is going opposite. And so these people actually hyperventilate where there's not enough carbon dioxide. They're breathing too fast. So they're blowing off excess carbon dioxide. Diseases that this can occur include anxiety, panic attacks, and those are really common answers that you'll get on an NCLEX. So if you don't need this information now, save it for later. Pulmonary emboli can also impact that. People in early sepsis, they present to the hospital, they have that low oxygen saturation and their pH is really high. People in pain, pregnant women, and those that are on mechanical ventilation, which is why we have to really pay a lot of attention to those that are on vents, because there can be a decrease in carbon dioxide, meaning the patient can hyperventilate. So key idea is too much ventilation, the carbon dioxide actually drops. All right. So the third disease that we're going to talk about is metabolic acidosis. This is when we're actually looking at bicarb and where you get this buildup of bicarb. So it's too much acid or you're losing too much of a base. All right. So common diseases we actually can see this is in DKA, diabetic ketoacidosis, lactic acidosis, severe diarrhea, okay, kidney failure, and aspirin toxicity. Sometimes people take an overdose in aspirin, and that can also lead to that. So the key idea here is that the body is too acidic and they can't buffer it, because remember, the body's always seeking homeostasis. But in these disease processes, the body is having a difficult time managing it. All right. And last but not least is metabolic alkalosis. This is when your bicarb is really high and you have too much of a base or acid loss. All right. So think losing acid or gaining base. Common causes include vomiting. That's the most common answer on NCLEX exam or an exam. And you can only imagine that if a person is vomiting too much, then they're losing too much of their acid. Okay, think about that. A person that has an NG tube and they're connected to suction. Again, this is why we're always paying attention to a person who is hooked up to suction to make sure it's not too much coming out too fast. Diuretics, those people who are taking diuretics maybe to control their hypertension because they can lose both hydrogen and potassium. Excess antacids or bicarbonate intake. You want to pay attention to those patients. And hypokalemia, those people who have a low potassium because there is a shift that can happen which can lead to metabolic alkalosis. So remember, losing stomach acid, the pH is going to actually go up. And so that is what we want to take a look at when we're looking at metabolic alkalosis. All right. So quick trick. Anytime you see an oxygen problem, you're going to think lungs. If you see a kidney problem, you're going to think that there's a problem with the bicarb. If you see anxiety, you're typically going to think of respiratory alkalosis. So I hope that helps. I will see you next video. Bye for now.